Hello everyone and welcome to Optimal Movement Method. Have you been experiencing pain in front of the knee while running, walking, squatting or climbing up and down stairs? One of the most common reasons to have pain in front of the knee is PFPS. PFPS stands for Patello femoral pain syndrome. Patella, which is your kneecap, is a floating bone and supposed to sit and glide in the groove between the two condyles of the femur, which is your thigh bone. If the patella moves laterally or outwards during the knee movement, it tends to rub against the outer condyle, which results in pain. If ignored, this rubbing may result in degeneration, which is known as patellofemoral osteoarthritis. Before we look into the exercises, we need to know why does the kneecap maltrack or move outwards. Kneecap movement is controlled and fine-tuned by your quadriceps muscle. Quadriceps is a group of 4 muscles, 2 in the center and 1 on each side. If there is weakness, tightness, or muscle imbalance among these muscles, it may result in PFPS. Factors which may affect quadriceps function during movement are poor foot mechanics and weak glutes, which I explained in these 2 videos. So now let's target all the areas. First, we need to improve our flexibility. Use a foam roller to release your quads and TFL. Work on the front and side of the thigh. Spend around 2 minutes. If other muscles like hamstrings and calf are also tight, I would recommend you to foam roll them also. Later you can find the link in the description below on foam rolling. Next is stretching your quads and hip flexors. To stretch the quads, grab one leg around the ankle and pull it towards you. Feel a nice stretch in front of the thigh. Hold for 20-30 seconds and repeat twice. Now go into a half kneeling position with back knee on a cushion. Tuck in your belly button and lean forward. You should feel a nice stretch in front of the hip joint. Make sure your pelvis doesn't turn to one side and lower back stays neutral. Hold for 20-30 seconds and repeat twice. Next is one simple retraining exercise for your quads. Keep your knees straight and contract your quads. Focus on the contraction of the inner quads, which is VMO. It should also contract along with the other quads muscle. Contract 30-40 times, few times a day. Now time for some strengthening exercises. First is wall sit. Back against a wall and sit with your ankle, knee and hip at 90-degree angle. Make sure the knees are just above your ankle and in line with your second and third toe. Hold this position for 30 seconds to a minute, as much as you can, and repeat 3 to 4 times. If in case you feel pain while doing this exercise, you can try doing 2 things. 1. Sit up slightly higher, or keep a ball between your knees and squeeze. Next is glute bridge. Lie down with your knees bent, heels close to you. Now roll your pelvis slightly towards you and lift your hips up while squeezing your glutes. Do around 3 to 4 sets of 12 to 15 repetitions. Third is single leg hip hike. Stand sideways with the ball or roller against a wall. Bend the knee close to the wall. Now roll the ball by lifting your pelvis up and down. Keep the knee straight of the standing leg. You will feel glute med muscle working on the standing leg side. Do around 3 to 4 sets of 12 to 15 repetitions each side. Next is calf raises. Stand with your feet apart. Now tiptoe while keeping your knees straight. Repeat around 15 times and do 3 to 4 sets. Do these exercises for at least 1 to 2 weeks, then progress to more dynamic and functional exercises, which I'll be showing you in the next part of this video. So don't forget to subscribe to the channel and hit the bell icon so that you don't miss any videos. And if you have any questions, please ask in the comment section below. Stay fit, keep going, love life.